Hi all, happy Saturday. It's Dr. Sue. I'm sitting outside in the sun with my pup and just wanted to just pop on here. I wanted to make a video about something that has been a big question for many parents when it comes to treating their kids and managing illness. I want to talk about antibiotics, and antibiotics are something that there's something that we really take very seriously when we order them for children as well as adults. And they are only for bacterial illnesses. Now, when we say that your little one has a viral illness, which 99% of the time they do, we mean that you do not need antibiotics. You do not need a medication that takes care of killing a bacteria that's going to help the symptoms. There are some specific bacterial illnesses that we do treat with antibiotics in children, namely strep pharyngitis is one, strep throat, urinary tract infections is another. Can you get sinusitis as a child? You can. It's pretty rare, and generally symptoms have to be lasting longer than 10 days, and unfortunately with worsening symptoms and not improving symptoms with time. But there are a few bacterial illnesses that you will know that as a physician that we will order antibiotics for. When we say that you have a viral illness or your child has a viral illness, it's actually something that means it's a reassuring kind of category. And what I mean by that is that our bodies can heal from viruses. Our bodies generally just need some supportive care to do that. An antibiotic is not a treatment for a virus. So when you go in to see your doctor or to the urgent care and you're seeking out an antibiotic, and the doctor or the practitioner tells you that it's a viral illness and that an antibiotic is not needed, try to realize that this is a good thing. It's a reassuring thing that your provider does not want to give an antibiotic when it's most likely not needed. Many parents don't quite understand the difference with viruses and bacteria. Bacteria are something that antibiotics can break the cell wall down and actually kill the bacteria, whereas viruses do not respond to antibiotics, antibacterials. They just don't, because they're not bacteria. So knowing that information, I want you to really try to find providers that you trust. Try to ask the questions that you need. Realize that prescribing antibiotics for a viral illness is not good medicine. It's not the way that physicians choose to practice, and it's not something that I want families to feel like they need to go in and demand antibiotics from a provider that is doing their best to take care of their kids. If there is a question that you have, remember you've got your own pediatrician. Working at the urgent care, I do see things on a different side as well, because I do have my own private practice at Purely Pediatrics. So I know what it can feel like when families come in and they feel that they came in and waited a couple of hours for an antibiotic. And when you tell them that your children are not bacterial, and they get irate, and it's very hard. So I want you to do this. I want you to trust your docs. I want you to talk to your doctors, communicate your concerns, and realize that we go through a ton of training to learn about different medications and learn about different illnesses and how to manage them. And we love to share information with you. So please ask the hard questions. Ask about what makes something more viral versus bacterial. Don't be afraid to ask those questions. We love questions from our families. We never take offense. We want to make sure that families understand where our thoughts are. If we diagnose something as viral and it's getting worse, and we do some testing and we find it's bacterial, then of course we will order antibiotics. But sometimes it can take some time to understand where an illness is going to head. You do not want a provider to order antibiotics for your child or for yourself if you're dealing truly with a viral illness. Try to find peace in that. Know that you can go to your provider as often as you need to and communicate with them as often as you need to. Same thing with the urgent cares. If you feel that something's getting worse in a couple of days and you can't reach your doctor, then to get seen there again is just fine too. Just know that we are all doing our best, and if this helps you at least a little bit to understand why a provider is not ordering an antibiotic for your viral illness, then that's my goal. Thank you all. Have a great day.